Welcome to Trifecta Collective, Finding the Root, where we dive deep into understanding and addressing root causes of chronic health issues so you can help and find healing inside and out, now and forever. Hello, and welcome to Trifecta Collective, Finding the Root. I'm Megan Abbott, owner and founder of the holistic health practice Trifecta Collective. Welcome to the podcast. So, today is a hot topic for me, and I am really going to try and do my best to come at this from a logical, educational kind of standpoint. And this is one that hits really close to home for me. So I have a lot of feelings about this episode of women are not small men, and we should not be treated as such. And I wanted to go with some historical background. I also, before I do that, I want to share some of my motivation going into this podcast. And then I also want to share just some things that I've seen with myself. I've worked with thousands of women in their health and healing journeys in a variety of capacities. And I'll tell you, the stories that I hear are so similar, largely so similar. And so I also want to share that because I think that is also a huge part of, as women, our own health and healing journeys. So I also do want to emphasize that. I'm also going to share, I'm a little stuffy today. So if I sound it, that is why. I am. I am in the middle of a full moon challenge right now, and it has just kicked up some histamine stuff going on. And so I'm just a little congested here right now. But otherwise I feel like totally fine. It's just from the parasite work. So motivation behind going to this podcast. So one, and I've shared little bits and pieces on the podcast here, but we have been spending many months now doing a lot of rebranding work, strategy work, like a lot of behind the scenes kind of work here. And looking into the next 5 or 10 years, where do we want this practice to go? What do I want my role to be within this practice? Who do we want to help? How do we want to help them? And how are we really talking about that? And what kind of messaging are we coming across? And how do we portray our goal of essentially helping as many women as possible heal, reconnect with their bodies and heal? How do we do that in more forward-facing, direct, and even offering? I mean, we're looking at anything and everything you can think of. We are looking at all of that. We are almost done with the branding side of things, externally facing. Have just finalized like colors and fonts and all of that kind of like a fun stuff. And kind of the last piece here is going to be the website and implementing all of that and putting that on the website. And what does that look like? And we're going to have some new offerings. We're going to have some redefined offerings. We're doing a whole lot behind the scenes here. And so really, as we've been talking about, all right, what do I really want this practice to be like 5 or 10 years from now? It's become very clear to me that women's health is 100% my priority. And women of all ages, really, kind of who are just trying to feel better, who want to feel like themselves again, who want to feel better, who want to feel energized, who want to show up for themselves, who want to show up for their family, want to show up for work, want to show up for friends, want to show up as, and I hate the word best version, but as good as they absolutely can be, and knowing that healing is possible in a world that, as I'm gonna talk about here, doesn't always believe us or support us, and has a very historical precedency of this, and is still continuing to do a lot of this. And how do we do this without boatloads of supplements, about all of the biohacking things? Do you have to do it this way? Do you have to do it that way? Because I don't believe any of that is true. Yes, I think supplementation for chronic illness issues, as we're going through and healing a lot of this, yeah, I think they can be really valuable. And long term, the goal is not to be on those. Like I've shared before, multivitamin is kind of like the end goal for me. And then if people want to optimize different things, yeah, absolutely. Like that's totally your choice. And you really shouldn't have to be on much of anything on a day-to-day basis. So the other motivation behind this episode. So there is a movement that I'm seeing. And full disclosure, I still follow a lot of people in the fitness space. I'm always curious what's going on in that specific world around nutrition coaching. What are the big weight loss people? What's going on in their world? What are they talking about? And there is a movement right now, and once again, this might just be my bias and the content that I'm seeing and being exposed to, is there's a lot of male coaches right now. Fitness coaches focused on weight loss, people who teach other coaches, coaches who in the past I have very much respected and very much followed along the majority of their line of thinking. And they are coming after women's hormones right now in a big way that really aggravates me. And that is a light term. It is hard to rile me up. It is hard to get me upset. It is hard to get me angry. It is just not, I'm a very patient person. Come from a place of seeking to understand. So it is rare that I get really riled up or angry about much. And I will tell you, I am livid at these individuals and the movements that they are really exposing right now. And they are all males. I'm looking at their content. It's not a one-time thing. It's been going on for a couple months now. And I'm not a big commenter on social media. I actually don't spend that much time on social media, even though that we put out a lot of content on social media. But I have commented on a couple of these posts from, once again, big names, and I try and come from a place of seeking to understand, and I'm not trying to fight with anyone on social media. I do not see the point. If people disagree with us on social media, that is fine. We'll either just ignore the comment, like think what you think, give you a thumbs up, be like, that's fine. You don't have to agree with us. That's totally okay. And some of these responses I've gotten back have riled me up even more. And I don't like to name names, so I'm not going to name names. But people are coming off after cortisol about the reality and impact of our sex hormones, especially in perimenopause, when it comes to weight gain and weight loss, and reshaping body composition and thyroid hormones. And as someone who's experienced all of those issues, who was eating just about perfectly, who was moving in a way that was very supportive of weight loss, of fat loss, of body transformation, of increasing muscle mass. Look, I know how to do the bulks. I know how to do the cuts. I was preparing for a bodybuilding show before I got in my car accident. And I wasn't stage ready for sure. I was still several months out before my first show. And I was in pretty darn good shape. And I looked pretty darn good, if I do say so myself. So the fact that these individuals and this movement is disregarding the role that cortisol really plays, and that really comes from a lack of understanding of the role that cortisol plays in our bodies and how women are impacted by stress very differently than men. The fact that our hormones don't work on a 24-hour cycle. We work on a 28-day cycle, and then we go through perimenopause and menopause, and then it's totally different. And then our thyroid, by the way, women are more predisposed to thyroid issues. And once again, I'm going to get into a lot of this here in just a moment. Once again, I had hypothyroidism that doctors would not check my thyroid numbers. I had to end up going to the functional medicine, my first functional medicine doctor. He finally checked my thyroid, didn't do all of the markers, but then I was diagnosed with hypothyroidism. And I was like, well, okay, well, that at least explains why, as to at least a piece of why I'm gaining weight. And I have not changed anything in my life. And I mean, I have cortisol tested. I mean, I just have so much information just on myself alone. Once again, let alone the thousands of case studies with individuals that we've worked with, that women that we've worked with and helped in their own health and wellness. So that is extremely aggravating to me. And that really just goes to show, once again, for me, men will never understand. No offense. And here's the thing. There are wonderful male practitioners. There are wonderful male coaches. Many of my mentors are men, and I agree on a lot of things with them. And they believe women's stories, and they understand the science behind all of this. And once again, there's this movement right now of people who don't quite understand the female experience of what it's like to literally be bawling your eyes out one moment, and then the next moment want to quit your job, want to divorce your husband, want to murder someone for making a small, minor, inconvenient noise in or near around you. I don't think they will ever understand that. And the fact that if you work out and seemingly a really basic workout, okay, well, now you're not sleeping that night because it spiked your cortisol so much because your body's in a chronic state of stress. By the way, once again, like, I have a test to prove that happened to me with real lab numbers. So I just get really annoyed and aggravated, and it feeds into this whole story of, look, women are not the same as men. That is the reality of the situation. Our health, our bodies, we do not operate the same. And that can be an amazing superpower if we can tap into that, and if we allow ourselves to tap into that. And what does that really look like in our lives? So let me back up here a little bit. Let me start with some information in case you don't know this. And I know you shared a couple of these things on the podcast in the past. And I do think it's really important to revisit this and to really understand where I'm coming from with this, from some real data points here. And then I'm going to throw in some stories as I go along. Once again, personal stories that I have heard hundreds and hundreds and hundreds of times over and over again of women that I've spoken to as I've done this work. So first and foremost, until the 1990s, almost all drug research was done on men. It was not until 1993 that there was some requirements starting to be put in place that required women to be part of studies. And a big reason why they didn't do this is because women's bodies were deemed too complicated, and there were a lot of concerns about hormonal fluctuations, about potential pregnancy. And so the vast majority of clinical trials were done on middle-aged white men, which we are not middle-aged white men, and our bodies don't work the same. So this looks at drug dosing, side effects of medications, efficacy on medications, adverse drug reactions. These were not studied on women largely. Once again, we were not included in these studies until 1993, which for reference, if you're not great at math, which I'm also not great at math, that's just like 30 years ago. 30. Some of these medications that many people are still put on have been around for more than 30 years. That women are put on all of the time. So let's just think about that for just a moment. Just the impact of that on our bodies. And I know there's a whole thing about Tylenol going on right now and pregnancy, and just like this feeds into this narrative of, yeah, women weren't studied and largely included in clinical trials until the early 1990s, which is wild. And once again, it was not that long ago. That was in my lifetime. I was very young at that time. And that was in my lifetime that only this started to happen, which once again is wild. Cardiovascular disease. So heart disease is the #1 killer of women. And I don't know if you've ever seen a show where someone has a heart attack. They almost always grab their chest, have a feeling in that left arm. That's how heart attacks present for men, not for women. So women, #1 killer of women, we present differently with heart attacks. So this often looks like shortness of breath, nausea, fatigue. I also don't want to scare anyone because those are three symptoms that are also actually quite common that we see in our practice. So just because you have those doesn't mean you have heart disease or you're having a heart attack. And those are 3 of the more common ones for women, which means that heart attacks in women are often misdiagnosed or not caught very early, which then leads to worse outcomes. Still, this is a still true kind of thing, which is once again, wild. I know before I got into the health and wellness space, I didn't know outside of watching a Grey's Anatomy episode where Miranda had a heart attack and she had a fight to get the proper testing done to realize that she was in fact having a heart attack. Otherwise, I didn't know this. No one teaches us this. At what point are we made aware of, hey, you've got some health concerns. Hey, I don't love the family history piece of this. You've got a family history. Hey, you're eating like garbage. Hey, you never move your body. Here are some important signs to look out for that may indicate you're having a heart episode, whether that's a heart attack or some sort of cardiovascular attack of some sort. And maybe there are some doctors that do that. And maybe I'm just not at the age where any physician has told me that at this point. However, once again, I've worked with thousands of women, and I've never once heard someone bring to me, hey, my doctor warned me that this might happen, and then this happened, and I knew I was having a heart attack. I've never, zero times I've heard that. So I think that's important to, once again, just acknowledge that that is still going on for us. Pain. So women almost always wait longer for pain meds in the ER. Many pain conditions, such as endometriosis, will go undiagnosed for 7 to 10 years. 7 to 10 years. That's a long time, and I will tell you that is an accurate statement, which is very frustrating. One, endometriosis is a woman problem. And so many women struggle with it. I think endometriosis is harder to get a diagnosis for than PCOS. PCOS is very challenging to get a diagnosis for as well here. But this is chronic pain conditions, and we're often dismissed, and I 100% fell into this category when I had my back pain issues, where I was dismissed. They're like, no, you're fine. Physical therapists, orthopedic doctors, orthopedic surgeons, spine and pain management specialists. I saw all of these people, multiple of these people, and so much of my pain was dismissed. And their recommendations were, okay, let's try some injections. Let's try burning off some nerves. Let's try doing this procedure. And nothing worked. And so they were like, okay, pain meds are our only option at this point. And no one asked me about my family history with addiction, which is also mind-blowing. So, and once again, this is not an uncommon story. I've heard this story. This is my story, and I've heard this story more times than I can count. But why do we have to wait so much longer for pain meds? Why is our pain dismissed as being just in our head, as being, oh, it's just anxiety or it's just stress, it's just psychological? Okay, and why are we not bringing this up for men? Or why are we not doing the right kind of testing to understand women's pain may look different, which is okay because we are different, but why are we waiting longer? Why are we not being believed? Why is our stories not being believed when it comes to pain? Which is wild because most women have a higher pain tolerance than men to begin with. We deal with our period every single month. And I know this is silly and, there's some validity to this. Those period, I don't know, machines that replicate what cramping can feel like and how most men tap out pretty early on. And if you compare men to the women doing it, I mean, women are largely unfazed by it because it's a common part of our lives. And by the way, it doesn't have to be. And we're so used to it at this point because we're told that's just what is normal, that when men experience anything similar, even in a lesser capacity, they wiggle around. They can't handle it. It hurts. Like they're visibly in pain, and yet our pain is still dismissed when we go into the ER. Just some questions to ask, some things to think about here. All right. Actually, I'm going to save this one for last year. The next one is autoimmune diseases. Women make up to 80% of autoimmune patients. Autoimmune diseases are still very under research and often dismissed. Now, I did pull this study and I have heard very different ones. So I'm going to share the one that I found, and I'm going to share an old one that I have heard and that I've also, I relate more to the second one, and most of the women that I've worked with relate to the second one. So it says most women are going to wait about 4.5 years and go to about 4 different doctors to receive a diagnosis. And it says about 25% of those wait more than 10 years for a diagnosis. So the old study, and once again, I say this as someone who has had an autoimmune disease and had a lot of trouble getting it diagnosed. 4.5 years, one, that is still a very long time. 2, the last statistic I heard and I had read when I was kind of deeper into my autoimmune research was 7 to 10 years. When most women will wait 7 to 10 years and see up to 12 different providers before receiving a diagnosis. That's a really long time for something that systematically impacts our entire body. It's a long time. Once again, it's why are we not believed? Why are we not getting the right testing done? Why don't more people, if there are thousands of autoimmune diseases out there, and we know that women are 80% more likely to develop an autoimmune condition, and there's a huge trauma component to that, by the way, which women are more prone to carry around trauma long term. Lots of good studies on that one. Why are we being dismissed by the Western medical system? Why? Why? We know this is true. So why is nothing changing? Why aren't physicians largely believing women to believe that something is wrong, something is going on? There is something off in our bodies. That's a really big one. And once again, that's one that hits home very personally to me. And I mean, we work with a lot of women who have autoimmune diseases. We do find, even on top of that, we do find a lot of autoimmunity, early stage autoimmunity within our practice. And it's not expensive, largely, the way that we look at it, largely it's a CBC with differential. Shows us early signs of this. It's a standard test that should be run every year for every human being. essentially. It's, like a metabolic panel and a CBC with differential are two of the most common blood tests that are out there. So why are physicians not trained to look at early stage autoimmunity or run proper testing? Even specialists. If you've ever been to an endocrinologist, if you've ever been to a rheumatologist, it's very rare that I hear very positive stories about a lot of these people. And these people largely find, by the way, autoimmune diseases and work with people who have autoimmune diseases. Yeah, it's oh my goodness, gastroenterologist. Gastroenterol. Oh man, I am having a hard time with that word today. GI doctors, they find lupus and Crohn's. Why are they not looking deeper here? Why are they not believing women? I have all of these gut issues, and you're like, oh, well, you just have IBS, which is a blanket diagnosis, meaning, hey, you've got a bunch of gut stuff going on, and we don't know what's going on. And so we're just going to give you this diagnosis and maybe tell you to eat a low FODMAP diet. And that's your life forever. Miralax if you're constipated. Not great. It's not great. Okay. This is a fun one. And once again, this is the one that I largely experienced. So they called this one in my research here, it's all in your head bias. Basically saying that women today are so more likely to be told that their chronic issues are anxiety or depression first and to be prescribed medication for that before digging deeper into any other issue. It was historically called hysteria. So instead of running testing, instead of coming in from a perspective of, hey, you feel like there's something going on in your body, feel like there's something off, there's some weird things going on, I think it's just in your head. I think it's just anxiety. I think it's just depression. And by the way, yes, it can be. And I'll also tell you, I have met very few people with chronic health issues who don't also struggle with anxiety and or depression. If you've lived that life for more than a few months, arguably even more than a few weeks, it can really take a toll on you. But there is a level of obviously physical discomfort and physical shifts and things that are physically not going the way that they're supposed to. But then that also takes a huge mental toll because let me tell you, you're probably thinking about that thing quite a bit. There's a huge emotional toll because after a short period of time, people get really tired of listening to you, whether that's real or perceived. And so most people stop talking about it. And so they just hold it all in. And then there's that emotional component to that where you feel lonely, you feel isolated because you can't talk about it because no one believes you. And you think, okay, well, maybe it is really just all in my head. And maybe I just need to go on an SSRI or some sort of medication around this. And that'll just fix everything. For some people, those medications can be very helpful and very beneficial. And for most, when there are real things going on in our body, it doesn't work. For me, once again, I was on medications for a decade, for essentially a third of my life at this point, just under. And I felt like a zombie at best. And I'll tell you, when I was going through my own health struggles, the chronic pain stuff, and then all of, all my other body stuff that was going on, I mean, I really did get to the point where even with the knowledge and background that I had and the education that I was getting, I was like, well, maybe this is all in my head. Maybe this is just my anxiety and depression coming back. That's been gone for many years. I had been medication free for many years at that point. I had a lot of tools in my toolbox. I had some tools. In my toolbox. I have way more tools in my toolbox now. And maybe it isn't all in my head. After a handful of people, especially people that you trust, like physicians, tell you that they think this is all in your head, you do start to believe it. And the question comes up of, am I crazy? Is something bad going to happen? Am I really going to lose my stuff? And is something bad going to happen? And trust me, I was there many times. And I have this underlying, tenacity, if you want to call it, fight, just inner knowing that can also, maybe it's a slice of ignorance going on there of just like, I really believe that there is better in life, that things are going to get better, that things are going to work out. And I don't know what you want to call that, some level of positivity, of ignorant bliss. And I do believe that too. And so it was like, man, am I just crazy? I was just like, I just believe that there is something better for me. It feels like there is something wrong. It feels like something's not right. I don't know what that is. I don't know how to find it. I'm pulling my hair out that is already falling out, trying to find these answers, trying to find anyone who will listen, trying to find anyone that will help. And over and over again, I'm told it's just in my head. And that can put you in a really dark place, which obviously then can just fuel and exacerbate the depression and anxiety that comes with chronic health issues. But of course, if you chronically do not feel good, if you are tired all of the time, if you are not sleeping, if you're bloated all the time, if you have an immense amount of food sensitivities, if you feel like you're allergic to life, if you feel like you are literally out of your body, out of your mind for 7 to 10 days because of hormone fluctuations going on in your body, it's easy to fall into that trap of, yeah, I must be crazy. It's just me. I'm here to tell you it's not. And a big piece of what we do here is I believe every woman's story. I have yet to see anyone, male or female, but especially I'm really focusing on females here, come to me with some labs, with symptoms, and I'm like, yeah, I think you're fine. I really do just think this is anxiety and depression. Zero. That has happened 0 times. Zero. Literally zero. There's always something that comes up. There's always patterns, always labs, all symptoms, different things that I'm able to put together. Well, I'm like, okay, well, this is a good starting point. Like, this could definitely be playing a role. Let's work on this. Let's get some foundational work. Big picture, maybe we need an additional test, maybe we don't. And big picture, here's what I think is going on based on your labs, based on your symptoms, based on being in this space and working with thousands of women. Once again, I believe you. So let's figure it out and let's figure it out together. And if you've ever, and I hope this comes through on the podcast, and if you've ever been a client of mine, especially like worked with me directly, I have these conversations all the time where I'm like, look, I want the very best for you. I am your biggest cheerleader in your healing journey. And I just continue, even with the size of the practice that we have, I continue to go out of my way every chance I get to show up for my clients, to serve my clients, to bring in resources, to respond very thoughtfully to emails, to messages, to provide explanations, theories, what emotional support, just space to be seen, to be heard in their journey and their experience. And I'll tell you that is some of the most important work that I do in my perspective, at least, is to be able to hold that kind of space and be like, look, we are in this together. I'm not going to give up on you. I didn't give up on myself. Everyone else gave up on me. And I found my answers and I did. I eventually healed. And I believe that is possible for every single female. Now, is it going to always be really simple? No. Is it going to take just a couple weeks or a month or two? Probably not. Are you going to have to make some shifts and changes over time? Yeah. And I'm here to walk with you with all of that and find a way to help you in your healing journey that also is suitable for you in your life and works with where you are and where you want to be. And what does that look like? And That is obviously not a part of Western medicine for a variety of reasons. I'm not knocking Western medicine. Western medicine's great for many things when it comes to chronic illness stuff. Not great. This information shows a lot of that. Okay, so let's continue on here. This is one that I actually did not realize was still the case. And it is. So the US still has the highest maternal death rate among developed nations. That one's a head scratcher. Why? Why? That one is mind blowing. And I think there's a lot that goes into that. And I'd love to have a fertility expert come on and dive more into that. And that is not my area of expertise. I can definitely help women throughout their pregnancy and postpartum and actual, the birthing process, having a doula, a midwife, an OBGYN, something along those lines, someone who is really deep in that space. I think it'd be really beneficial to talk to them. And I know often, once again, so these are stories that I've been told. I don't know 100% the validity of this, and I would believe it, that C-sections are often over-recommended, and there can be a lot of complications that come along with that. But in the United States, the fact that we have the highest maternal death rate of all developed nations, and we are at the forefront of Western medicine, arguably, that's still the case. Wow. Wow. Why? Why? Once again, questions. Why are we doing studies on this? What do those studies look like? What are we doing research to how do we need to support women throughout their pregnancy? How do we help women prepare for pregnancy? What needs to happen during the birthing experience? Is there complications that are preventable? And of course, there's always going to be things that come up that things are not preventable. And I totally understand that. But for the US to be a leader in the Western medical field and still have the highest maternal death rate, that's alarming and really should raise some questions that we have about women's health and wellness and how we are supported here. Drug dosing. So this goes back to the studies here of, so medications are still often based on male physiology. So we are not the same as men, and the dosages of medications should probably not be the same as men too. So the example that I was able to find here, just a quick example, was with Ambien, which is a sleep medication if you're not familiar. Pretty wild sleep medication. I've been on a lot of sleep medications, and things can get weird on Ambien. I remember I was on Ambien for at least a few months. And I mean, just the vividness of dreams and I mean, waking up super, I mean, for me, that was one of the worst, like, quote unquote, hangover side effects from a sleep medication that I ever got. And but I had chronic insomnia. So I was willing to try anything. And just like being able to sleep a little bit was better than being groggy in the morning. So, but yeah, Ambien's wild, for some of us at least. So women were overprescribed this for a long time because we were given the same dosages as men, and this led to a lot of accidents, which then triggered a reevaluation of, okay, what should actual starting recommendations for dosages actually be for women, and what does that really look like? So, just when you think about medication, and by the way, I know we work with a lot of people who are very sensitive to medications, to supplements, to a lot of things in their life, and there are reasons why that is the case. If you're one of those people and you are starting a new medication, and by the way, if you're working with a practitioner who doesn't understand this, that should be a huge red flag. A lot of medications have very low dosages that you can take as a start. And so asking your physician, hey, I tend to be sensitive to a lot of these things. What is the lowest dosage that I can start at and then work my way up depending on how I feel? And this can really limit some of the adverse reactions that people experience. on medication, especially individuals, once again, who are very sensitive to medications. Also, please, before you go on any medication, just ask questions. Just get some information yourself on how long do I have to be on this medication? What are possible side effects? What are common side effects? What are rare side effects? What are some things to look out for? And when do I need to call someone immediately and stop the medication if and when these things come up? Is this something I'm on forever? And if so, what is the reason I'm on it forever? What is it doing within my body that would trigger for me to have to take this forever? And if it's not, what does coming off of it look like? And I say that really for SSRIs, first and foremost. Please ask questions before you decide to go on an SSRI, which is often prescribed for anxiety specifically, and some people with depression will also be put on it. Some of the worst side effects I've seen from individuals who I've helped take off of this medication along with their physician. I know plenty of people who have come off cold turkey or by themselves. I am one of those people, and the side effects were horrific. And I would never recommend you come off of that by yourself or stop cold turkey. And there's a lot of medications that are out there that are like that. And so once again, just asking questions. It's not that medications are bad inherently. Ask questions, just get more information, have a really good breadth of information before you make a decision, yay or nay. No judgment either way. Just it's really important that we take our own health and health decisions into our own hands at some point. And once again, just ask questions. If your doctor is unwilling to answer basic questions, go find a new doctor. Because guess what? If you do have issues on that medication, who's going to be there for you? Not that doctor that won't answer any of your questions as a starting point here. So please keep that in mind. Please, education is power when it comes to your health. So the last kind of big section that I want to talk about is reproductive health. This was early on in my list here. This was originally number 3. And this is a big topic, and I'm going to try and keep this relatively short so I'm not talking at you for an hour and a half kind of thing. So first and foremost, menopause research was ignored for decades. And this is where a lot of us get to experience this is just what happens when you get older kind of phrase when our hormones start to shift, which can happen as early as your 30s. For most, ideally, it's not happening until our 40s. It happened for me in my 20s. And I finally found someone who did some testing and was like, oh, you're in perimenopause at 29. Not great. So that's a big red flag. Also, birth control side effects were very minimized. Very, very minimized. I don't know if you've ever been put on birth control and try to ask your doctor about some of these side effects. Whew. They don't have a lot of answers here for you. Yeah, blood clotting for some of them, discomfort for a couple of days. You might get a little moody for a couple of days. And they really downplay the side effects. And there could be some serious ones. Weight gain, acne. Acne can go both ways, by the way, on these medications. If you get an IUD or something inserted in your body can attack it. And they will tell you that that is not the case. And once again, like that was me. I had an IUD, it was my last form of hormonal birth control, and I was on birth control for 16 years for reference. And I was on a variety of forms for birth control. And I still had, I'd done so much for my health. Like I was feeling so good by and large, but I still had this like weird lower belly bloat that I just didn't understand. And I finally decided to get my IUD taken out. Also, no one tells us what are the chances of you actually getting pregnant and what does this look like and how to track your cycles and what does this really look like. By the way, I've been off birth control for many, many years now, still not gotten pregnant because that's been my goal to not get pregnant, by the way. And I've successfully done that without birth control, which we all can too, by the way, if that is your choice. This is a very personal decision. Once again, ask questions before you make any decisions on things that can have a real impact on your body. But I got the IUD taken out, and within a couple weeks, all of that was gone. It was the IUD. My body was attacking and it was contributing to some localized inflammation going on in that lower part of my belly. And it went away as soon as I got it out. It's not the case for everyone. Some people do just fine. Some people don't. The mental and emotional component of birth control too is not to be ignored. I would say, especially if you have a history of any sort of anxiety and depression, I think being very careful and keeping a very close eye on it is really valuable when it comes to birth control, because birth control can very much mess with your hormones, block hormones, which then have a direct impact on your mental and emotional health. They can also impact your sex drive. They can also impact who you're attracted to. So if you make a big life decision of, hey, I'm going to be with this person, and I've been on birth control the entire time I've been with this person, sometimes that doesn't go so well at the end. I am case in point. Not that I think that was the only reason, and I do think that played a role in why I'm no longer with my former husband. Hormonal contraceptives, so birth control that essentially has both estrogen and progesterone, are also classified as a class 1 carcinogen. Class 1 carcinogen. Tobacco's in that category. Asbestos is in that category. So once again, just something to think about when we're making these decisions for our bodies. And whatever you decide, that is totally fine. That is your prerogative. It is your body. It is your choice. And we also have the right to have enough information to make good decisions when it comes to any of this kind of stuff, especially something as big as contraceptives. I think this is really important. 2023 was the first time that real blood was used for menstrual products. 2023. That was 2 years ago at the recording of this podcast. It is 2025 now. Why, before 2023, were we not using real blood? Because we all know, if you've ever had a period, it's not the same as water. It's not the same as a saline solution. That's not how periods work. Our periods are different. It is not just mere water coming out of our bodies and doesn't act like that. So why would our feminine care products, which by the way are largely have bleach and plastics and other chemicals at a place to our body that is extremely sensitive, especially tampons, if they're going inside your body, you are absorbing all of those bad things into your body, by the way. So if you are using tampons, any sort of menstrual care products, I highly recommend look at what's in your products. If you can swap out for something that is not bleach, something that is non-toxic, doesn't have the chemicals, doesn't have the plastics in it, it is way better for your body. I'll also tell you that before I switched many years ago, my body actually started rejecting tampons. Tampons is typically what I personally use, and my body, I could tell my body was just like, get this out of me. I do not want to have this in here. And when I made the switch to a more organic, natural form of tampons, total game changer. My body's like, okay, fine. We're okay with this. We're not absorbing all of these harmful chemicals that my body has now really come to recognize pretty quickly, whether that's directly or indirectly. And sometimes it's just like my body's like, oh, we don't like this. We don't feel good now. We're trying to tell you something. So, but this was 2 years ago that they only started testing these products with real blood. Why? Why? What? Why? That's the only thing I can say here. Why? Why? This is, there's data on this, and if you've ever had period problems, this is true. But if we have any sort of period problems, hormonal problems, birth control is the only option for you. That is what they are going to prescribe. If you have PCOS, you also might get metformin because it's going to help with the blood sugar regulation piece of it. Can also help with weight loss and weight management for some people. But why is that the only answer? Why don't we have any other answers than shut them down? shut down the body's natural production of hormones, which also don't just impact our hormones. Hormones impact our mental and emotional health, our cognitive function, our skin, both skin as far as like breakouts, but also can impact how bright our skin is, the elasticity within our skin, focus, concentration, joint pain. Hormones play such a big role in our body's libido, sexual, some of these more, uh, even for some in weight management is a big one that hormones can play a big role in. Happiness, your sleep, progesterone plays a big role in sleep. So why is shutting those hormones down our only option from Western medicine? Why? I'll also tell you that, once again, this is a personal story, but I've heard this from more than just me, that, when I wanted to get off birth control, my OBGYN tried to talk me out of it twice. And I also, because I had this lower belly belt, I was like, it feels like I just want to see if there's something hormonal going on. Like, I just want to see, I, I don't have a lot of the classic signs of PCOS, and maybe that is playing a role for me. And she immediately shut that down, was like, oh, you're not obese, so you don't have PCOS. Which, by the way, that is not a prerequisite for PCOS, is being overweight. That is not how that works. Yeah, that can come along with it, especially when there's a lot of blood sugar regulation, insulin resistance type issues. Yeah, weight can be a struggle. And that is not the case for every person with PCOS, by the way. So why? Why? And she, by the way, I found her as being more on the holistic side of things. The other thing we will often hear, especially if you're wanting to test your hormones, is, are you getting a period every month? If so, we don't need to test your hormones. Your hormones are fine. What? Just because I'm getting a period, that means my hormones are totally fine? I'm going into a dark, deep depression for 7 to 10 days. My skin is so itchy. I don't sleep for the week before my period. When I get my period, I have to take off of work because my cramps are so bad. My back hurts so bad. These are all real things that I hear all of the time. And just because you're getting a period doesn't mean your hormones are fine. Also, there's, once again, in this whole male movement, this male coaching movement that I'm seeing, is not understanding how our hormones change. So when we test, let's say we're testing testosterone in a male. Testosterone follows a 24-hour cycle throughout their day, and there are standard and common peak times. And so we know that if we're testing testosterone, and we want to look at total and free testosterone, by the way, and we may want to look at a couple other things depending on the person and their symptoms they're experiencing, we know the times of day, and we know what that's supposed to look like. When we look at hormones in women, so our hormones change throughout our cycle. Not all of us follow the same perfect 28-day cycle where, day 1 is the start of our period. We have our period for, let's say, 4 to 7 days, and then we're in our follicular phase. And then between day 14 to 16, we're ovulating. And then day 17 to whenever we start our period is our luteal phase. So commonly, most physicians will test on day 3 of your cycle, which I don't love, largely because most women, if they're going to have problems, it's going to be closer to ovulation or in their luteal phase, and in which case we really want to look at estrogen and progesterone and the ratio between those two hormones. But also the other thing we need to understand is, even within that 28-day cycle, on a day-to-day basis, we don't follow the exact same. Our estrogen is highest in the morning, and then it starts to drop, and then in the evening it's lowest, and then we don't follow this really nice, simple 24-hour cycle. If when we do a blood test, and I know we talked about this, and I've talked about this in several episodes now, but when we test blood is a moment in time, which for a lot of things is totally fine. Our liver enzymes aren't changing a whole bunch moment to moment. You know what is changing a lot moment to moment? Our hormones. So if we're coming to someone with a lot of hormone imbalances and we only test in that moment, let's say on day 19 to 21, which is more common, and we see numbers that are, let's say, fine, maybe they're probably not going to be optimal because Western medicine doesn't really work around optimal. But even let's say I look at these and I say, oh, these are pretty good. And you're experiencing a bunch of symptoms. Well, there's a lot of other things that could be going on. What about all of your estrogen pathways? What pathways are you following? How are you converting progesterone? What is being converted to progesterone? What about your pregnenolone levels? What about DHEA? What about your cortisol? What about testosterone? What about all of the testosterone and androgen pathways, which there's quite the handful of those? What about your two different estrogen or progesterone pathways? This is why we need to understand. And once again, if you're a woman and you've experienced some hormonal shifts and changes in your body, you'll know that things can change in a moment, which means that blood testing may not always be the most effective way to look at this. And it can be easier, especially if we're going on HRT, BHRT, we're trying to get our levels checked. Yeah, that can be a good strategy. And every once in a while, shouldn't we look into our pathways on what those are doing and make sure everything's going the way it's really designed and supposed to, and we're not following less desirable pathways that can turn on less desirable genes that can then trigger different things going on, including breast cancer and ovarian cancer? Why would we not want to look at those too? And so not understanding that full picture is very upsetting to me. And once again, like, this really riles me up because they're saying, a lot of these male coaches, if they are into lab work, which they're not, they don't have a really deep understanding of both the physiology and the labs and how they're actually run themselves. We can cause some real harm going on. That can be physical and that can also be mental and emotional. And I think it's really important to take all of these things into consideration. Okay, well, maybe we're under financial constraint. Okay, let's run the blood tests. Let's get them covered by insurance and let's see where you are. And let's put that piece together with the entirety of the rest of your labs and your symptoms and what's going on. And let's put all of the pieces together to really take a look at this picture that your body is trying to tell us. And let's make some decisions based on all of that information, not just bits and pieces, which is even where most people in the holistic health space, functional medicine space, land, by the way, which is once again still very aggravating and very frustrating. And I just see so many people, especially women, symptom managed. And I you're gonna waste so much time, so much money, so much effort trying to symptom manage all of these things. And that's why functional medicine practitioners offer all of these tests. And sometimes people are required to run like $1,000 to $3,000 worth of testing before they'll even start. And here's the thing. I know that is not necessary. Yeah, we can find all those things, but here's the thing. If we just find the big things and kind of work our way in and start to look, we can like dive in and peel back the layers as we go. The little things often work themselves out once the bigger things are addressed. So why would we not look at the bigger things and then work our way in? Why are we only looking at the thyroid with thyroid issues? Why are we not looking at nutrient deficiencies, at gut health, about toxin load, about liver support? Why are we not looking at all of these things? Why are we cognitive health, neurotransmitter pathways, trauma? Why are we not looking at all of these things when it comes to our health and wellness? Why are we only looking at one thing? That doesn't make any sense to me. And by the way, it doesn't work. Otherwise, I wouldn't have a practice and I wouldn't do what I do and help so many people heal and stay healed long term. And that's a big piece of this. The last thing I really want to talk about with this, and just I want to put a little plug here. When it comes to perimenopause, there are very few medications that are available to us. And once again, largely this is just what happens when you age. This is what you're going to experience. It'll be over eventually. By the way, perimenopause can last for 10 years plus sometimes. It's a really long time to be dealing with a lack of sleep, mood shifts, cognitive decline, changes in your body, changes in your joints, sleep. I mean, all of these things. And we only have a couple medications that very largely mask symptoms. And by the way, most of the medications are just for hot flashes. So there are largely three medications. There's one that really helps with like overactive bladder that has also been shown to be able to help a little bit with hot flashes. What if we don't have bladder issues? And what are the side effects on our bladder when it comes to that? Questions. Gabapentin is another one, which I didn't realize gabapentin was sometimes prescribed for hot flashes and for perimenopausal symptoms, which I don't know if you've ever been on gabapentin. I was on it for many, many, many years. There's a lot of side effects. And at least for me in the height of my chronic pain issues, it had minimal effects, if that. Okay, there's a lot of side effects. A lot of side effects for gabapentin too, especially with long term. And then the other ones are largely SSRIs. There's two, one or two other ones. It kind of depends on who you talk to. I found some conflicting research going on with this, but one or two other ones that are SSRIs that can work with the brain in modifying body temperature and helping to regulate body temperature a little bit more. But these are SSRIs, so they have some pretty significant side effects on mental and emotional health. And some of these can really make these worse. Once again, the side effects coming off of SSRIs can be very significant. If you've never experienced what they call a brain zap, man, is that a confusing thing. And it is not fun. It is extremely painful, and I would not wish that on my worst enemy. And that is what we're offered in perimenopause and menopause. Why? So I hope you got some information out of this. I hope this wasn't too ranty. And I did feel like it was really important right now to do this episode and to shed some personal experiences, both personally and, with the amount of clients that I've worked with, but also share some of the science. And we really are different than men, and we should not be treated as small men, because we're not. We're not the same, and we deserve better. And if you are looking for better, we are obviously here as a way of support. We will take a look at all the things. We will help and give you some good advice or questions to ask at the very least. And we will always listen to you. We are always a safe space for you to be seen, to be heard, and believed in your story and what is real for you. Because we know if it's real for you, it is real. That is what matters. And we will help you start putting the pieces together here. So thank you for listening. As always, please like, subscribe, follow. If it resonates, 5-star reviews really, really, really mean the world to us. Thank you for listening, and I'll see you next time.